Hi, I'm Michelle Black and I'm a public health registrar working at the University of Sheffield at Shar.
And can you tell me about the poster and the work behind it?
Yep. So the Health Foundation commissioned some work from the Association of Directors of Public Health to look at public health across the 4 countries of the UK, and the ADPH commissioned Shar to do that. So we were tasked with looking at public health since devolution under Tony Blair in 1999 to see, to kind of try and look at how public health systems have changed since devolution. And in particular then to look at early years policy in particular, and to look at what similarities and differences there are. So this poster depicts just one element of the work, and that's early years policy across the 4 countries. And it looks at the approaches that are taken to early years policy. So in England we're kind of preparing children for school, whereas Scotland take a more nurturing approach in preparing children for life. You get a different visit depending on which country you're born in. How do those differences manifest themselves? What difference does that make in terms of outcomes? We don't know. Is, for example, health visiting commissioned in a way that reduces inequalities? We don't know, because of the universal provision that we offer. And then early years education, whether or not you get free school hours before the age of 3 or at 3, depends on, in England, for example, whether or not your parents are in work and how much they earn, etc. So it's linked to earnings. In other countries, it's a universal free benefit. So there's different framings, different reasonings, different political ideologies. And then we have how we assess children at age 5. So in England, it's about whether or not we think they've reached a good level of development and they're school ready. Scotland takes other approaches and uses online tests. But the story of this is that regardless of these differences, we've got stark inequalities across the UK. And in each country, if you're a poorer child, you have a best start in life than your richer peers. And this is grossly unfair. So this poster is kind of to provoke discussion and think about whether we need to learn more from the natural experiment environments provided by devolution to learn exactly what difference these differences in policy make, so that we can start to inform policy around reducing child health inequality.